Welcome to our video about root canal treatment and what you need to know about it. A root canal is a common dental procedure performed to save a tooth that is badly decayed or infected. It removes the source of infection and relieves pain. Unfortunately, root canals can also have complications. Keep watching to learn more about this treatment. If you're considering root canals, you need to know what to expect. This procedure has many benefits and may be the perfect option for your situation. Root canals are a dental procedure used to save a tooth that has become deeply decayed or infected. A root canal is a dental procedure that is performed to remove the decayed or infected pulp from the tooth. The infected pulp contains blood vessels, nerves, and connective tissue. Untreated, this infection can cause an abscess, loss of the tooth, and damage to bone and other tissues in the body. This procedure does not usually cause pain, and most patients report very minimal discomfort. Root canals are a common dental procedure for deeply decayed teeth. This type of treatment can save a tooth if it is infected and has no other options. This procedure may also be necessary if a tooth has become severely damaged and requires a root canal. Leaving the infection untreated can lead to an abscess in the tooth, which may spread and affect other teeth. However, there are risks associated with root canal treatments. A dental procedure to remove a tooth's deep decay and infection require the assistance of a specialist. During a root canal procedure, a small opening is made in the crown of the tooth to access the pulp. This is done using tiny dental instruments to remove the pulp inside the tooth. The pulp chamber is cleaned and disinfected. Then a flexible rubbery material is placed in the root canals to seal them and prevent the infection from spreading. They remove infection at its source. If you are experiencing a toothache, it's best to visit a dentist right away. They will perform root canal treatment to eliminate infection at its source and relieve your pain. If you don't visit a dentist right away, the infection will spread and cause even more pain. Getting treatment right away will prevent the infection from spreading and will ensure your tooth is as healthy as possible. After all, an infected tooth will not heal on its own. When root canal treatment is needed, a dentist will make a small hole on the top of your tooth, allowing access to the pulp chamber and root inside. Surgical tools are used to clean the root canal, and an antibiotic will be applied to prevent any future infections. Once the root canal is clean, the dentist will put a dental crown on the tooth, restoring your bite and preventing further infection. While root canal treatment may remove some bacteria, it cannot completely eliminate them. In fact, some bacteria still remain in the tooth, which can cause systemic disease months or even years after treatment. In addition, people with poor dental health should avoid root canals because of the risk of systemic disease and TMJ pain. A failed root canal may require another type of procedure or even a tooth extraction. However, the risks are still far outweighed by the benefits. They relieve pain. While you are recovering from root canal treatment, there are a few things you can do to relieve pain. Keeping a cool compress on the area can reduce swelling and relieve pain. Apply it 3 to 4 times a day. It is also helpful in reducing the risk of bacterial infections. For best results, avoid ice or hot beverages until the treatment has been completed. Root canal treatment relieves pain after a few days. If you're experiencing a toothache, chances are you have an infection in the soft, inner layer of the tooth. This inner layer contains the tooth's nerves and is susceptible to infection from decay. Inflammation in the pulp can occur as a result of a deep cavity, weakened structure, or broken tooth. The infection can spread throughout the root canals and cause pain. If the pain is not relieved by root canal treatment, you may end up with a tooth that is no longer usable. Anti-inflammatory medications can also be effective for reducing pain following root canal treatment. Anti-inflammatory drugs prevent inflammation, which causes pain. Ibuprofen, for example, is an effective pain reliever. If you experience discomfort after root canal treatment, you can take 2 or 3 200 mg tablets of ibuprofen every 6 hours. If the pain is more severe or lasts longer than a week, you should go see your dentist immediately. They can cause complications. Complications can arise with root canal procedures. Some people experience swelling and extreme sensitivity in the gums, constant pain, and pressure in the mouth. People with pulp damage may also experience pain when biting down. In addition, some people experience lingering pain a few days after the procedure. In such cases, it is crucial to contact your dentist as soon as possible. Read on to learn about the risks and potential complications of root canals. One of the most common problems following root canal treatments is an infection. Without prompt treatment, the infection could spread and infect surrounding tissues. Getting treated early can help prevent infection from spreading beyond the tooth. Untreated infections may also affect the face and bloodstream. Root canal shapes are complex and areas of infection may go undetected during the first treatment. In such cases, the infection may spread to other teeth and even the bloodstream. Other complications of root canal treatments include delayed root canal infection and tooth pain. A tooth that has been treated with a root canal may become painful months or even years later. If left untreated, the infection can spread to other teeth, gums, cheeks, and facial tissues. Symptoms of delayed root canal infection should be reported immediately to your dentist. They may recommend a follow-up appointment with your dentist to make sure there are no remaining infections. They are painless. Many people are apprehensive about undergoing root canal treatment. There was a time when root canals were associated with pain. However, the process is actually quite painless. Your dentist will use anesthesia during the procedure, which will minimize any pain you may experience. A local anesthetic is also available, if necessary. However, if you are worried about pain, talk to your dentist about alternative methods of fighting root canal discomfort. The dentist will first examine your mouth to diagnose the cause of the infection. He will also take X-rays to determine the extent of decay and infection. If the infection is severe, the dentist may need to perform another root canal. The entire procedure should take about an hour. It should be painless, and you should be able to get up and walk after the procedure. The dentist will then clean out the root of the tooth and remove the infected pulp tissue. A root canal procedure can be performed without using local anesthesia. It is much more comfortable to undergo this procedure if the tooth is already dead, so many people opt for it. There is also a great possibility that your dentist will not use local anesthesia. After all, tranquil shots are only for cowards. Besides, needle tips today are considerably smaller than they were 50 to 60 years ago. Another advantage of modern treatment is that topical gels can be applied before the minute needle tip. They are quick. Root canal treatment is a painless, fast procedure. During the procedure, the dentist will numb the tooth and gums, remove the infected pulp, and clean and fill the chambers with gutta-percha. The dentist may also place a temporary filling or a crown on the tooth. If there is pain, over-the-counter painkillers are sufficient. The procedure usually lasts between 1 and 3 visits. A root infection can be painless, but if left untreated, it can eventually weaken a tooth, fracture it, and even spread to other parts of the body. This can be a serious health risk, and a root canal procedure is quick and painless. The process typically takes 1 or 2 office visits, and most patients can have the procedure done in a single visit. To learn more about root canals, contact Robert E. Lane DMD, PA today. The procedure is painless, quick, and helps keep the structure of your smile. The dentist will first apply a local anesthetic to the area and remove the decay. Once the infected pulp is removed, the doctor will apply a filling material and close the access hole. The tooth will then receive a crown to protect it and maintain its structure. Although root canal treatments are a quick, painless procedure, they should be undergone by a dentist who has extensive experience. They are uncomfortable. If you are worried about getting a root canal, you are not alone. Approximately 6 out of 7 Americans are afraid of the procedure. But, root canals are necessary to save your tooth and treat pain. Here are some facts about root canal treatment that will ease your worries. First of all, root canals are uncomfortable, but they are necessary to save your tooth. You should have as much information as possible about root canals before getting one. While it is true that root canal treatments can be painful, it is still far less uncomfortable than a dental filling. Modern technologies have made root canals much less painful than fillings. According to the American Academy of Pediatrics, root canals are now 6 times more likely to be painless than traditional fillings. Many people visit the dentist for root canal treatment when they experience a severe toothache. Damaged tissues inside the tooth cause pain, and root canal treatment is one of the best ways to stop the pain. If you feel pain after root canal treatment, you should go to your dentist as soon as possible. The pain will likely subside, but if it persists, you should make an appointment with your dentist. A successful root canal usually requires 1 to 2 sessions. However, more sessions may be needed in more severe cases. However, if your pain is more severe than it usually is, you should visit the dentist again. In addition to root canal treatment, you should take pain medication to relieve the discomfort. You can take ibuprofen or prescription strength narcotics. If the pain is not as severe, you can try taking a temporary pain reliever, such as acetaminophen. Thanks for watching. Please like, comment, and subscribe for more.